Welcome to another episode of Be My Guest. On today's show, I have a very good friend of mine, Dr. Osoba, who is a psychiatrist doctor. She's going to cover so many aspects of the mind, depression, mental issues, things that normally, especially in the church and in the Black community, we don't like to discuss. But I'm sure you're going to be inspired and encouraged as you listen to this episode of Be My Guest. We're going to have to split it into two parts because there's quite a lot to cover. But please just stay tuned and enjoy.
Thank you for having me on the show.
Yes, it's so good to I've been trying to get hold of you, but I know with what you do is so busy, but today we've got you in the studio.
Yes, thank you.
So let's let our interviewers know all about you. So tell us just a little bit about, you know, where you started from, your humble beginning, what you studied.
Okay, my name is Titilola Osoba, and of course I was born in Nigeria to Nigerian parents. I grew up in Lagos. Okay. I went to primary school in Lagos. I went to secondary school in Abeokuta, Premier Grammar School in Abeokuta. Okay. And I did my A-levels at Ogun State Polytechnic in Abeokuta, where I met Pastor Joyce.
Almost 37 years.
We met in 1982, so we've come a long way.
That's right.
When I finished my A-levels, I went to Lagos University Teaching Hospital in Lagos, obviously, Idi-Araba, Lagos. When I finished in 1991, I went to join my husband-to-be. I went to Trinidad and Tobago to join my husband-to-be, and I worked there as a physician for a couple of years before coming to United Kingdom in 1996. So I did what is called the Professional Linguistic Assessment Board exam. I think most of you heard about that before, called PLAB. You need to do that exam before you are allowed to practice in United Kingdom. Okay. So after doing that exam, which I was successful, I think in 1997, I initially did some locum work, agency work, and eventually I got into basic training to become a psychiatrist. Right. So after doing that basic training, I did my professional exam, which is called the membership exam of the Royal College of Psychiatrists. Wow. And after completing that, I did my higher training. And in 2006, exactly almost 10 years ago, I completed my training, and I've been working as a consultant psychiatrist in Kent. Right. Since 2008, actually, because actually today I celebrated my 8 years with my current trust as a consultant.
Wow, that's amazing. But I need to take you back a little bit.
Yes.
So you went to university to study medicine.
Yes, I did.
Which is 5 years.
Yes.
Now I've had guests on this show who told me, my parents wanted me to either be a doctor or a lawyer. Now you did medicine. Were you interested in studying medicine, or how did you come about studying medicine? I know we did sciences together at A-levels, but is that what you wanted to study?
To be honest, I have always been interested in the medical profession. Right. I remember when I was very, very young, I wanted to be a nurse. Okay. Because back home in Nigeria, I just loved the uniform.
With a little hat.
With a little hat, nursing uniform. When I was very, very young, when I was in primary school, I used to imagine myself being a nurse. I used to walk up and down, seeing myself as a nurse. I mean, you could call that, somebody being drawn to their destiny. Right. And when I got to secondary school, I enjoyed science subjects. Okay. I really enjoyed, particularly chemistry. Right. So I changed my mind. I wanted to be a pharmacist. Okay. Because as far as I was concerned, if you were good at chemistry, you love adding chemicals together, automatically you would be a pharmacist. But my father, when I was doing my A-levels, said to me, "You are going to be a doctor." Oh, okay. Apart from myself, I've got a younger brother. My father said to us that he used to observe both of us. Right. That my brother was very good with his hands. He used to break things and kind of, put them together. My dad said, "For you, you're very relational. You love talking to people. You love being with people." That's right. So he was the one that encouraged me, actually, before my A-levels, because I did my JAMB, which is the Joint Admission Matriculation Board in Nigeria. And I remember him completing the first form and put medicine and surgery. Okay. And he put pharmacy as my second choice. All right. So even though I didn't pass that exam, the reason why I went to do the A-levels, he still encouraged me. And nowadays I say to people, I really thank my dad.
Yeah.
I mean, my father died almost 3 years ago, but I really thank him because I don't have any regret. I really enjoy what I do. I really, really enjoy it. So in a way, thank you, Dad.
Oh, that's good. So he kind of like was watching you and watching your brother.
Yes.
And you both ended up doing what he suggested.
Exactly.
He's also an engineer, as Dad had predicted.
Yes.
Well, that's amazing because parents have a role to play, or any father, mother figure in our lives. It's good to listen to them because sometimes young people still don't know what they want to do. But I'm glad. So now that you've done medicine and you've gone into psychiatry, tell us a little bit about that because, I mean, I know we are in the church, and when you hear of cases of psychiatry or mental health illness, there's always this stigma. But just tell us from your experience, what leads to it and how we can address it.
I mean, like I said, I work in mental health.
Okay.
And when we say mental health, people have got this idea of, oh my goodness, you've got physical health problem. For example, high blood pressure, diabetes. When we say mental health problem, it's just problem affecting your mental health being. The same way you've got your physical health well-being is the same thing to do with your mind. So mental health problems are problems that affect the mind. It affects the way people feel, the way people think, and the way people perceive things. The commonest, I work in the community teams, so I don't necessarily work in the hospital. My day-to-day job is actually done within the community. The commonest thing that we see is depression and anxiety.
With everything going on, I'm not
With everything
surprised.
going on. In fact, from 2008, because of the recession, we have seen an increase in the number of people having problem with their sleep, people suffering with anxiety, people having depression. We've seen significant number of referrals from the general practitioner to the community mental health thing. So we know that stress is got really a significant role in bringing about anxiety, depression, or sleep problem. Those are the commonest things that we see. We also deal with what is called a really severe and serious mental health problem, which is called psychosis.
Okay, what's that?
Psychosis just means that that particular individual is beginning to think and perceive things in a completely different way.
Okay, like they're hearing voices?
So a person who is experiencing a psychotic breakdown will talk about hearing voices when there is nothing around them to explain it. They might become suspicious of other people.
Right, okay.
They might start saying things like, somebody is putting poison in my food, or they might say things like, my thoughts are no longer mine.
Right.
You know, somebody is influencing the way that I'm thinking. Or they might start saying things like, some people are doing things deliberately to harm them. So you can see what I'm talking about. Their perception of things is affected. The way they're thinking, it's been affected. And when those two things happen, it begins to affect the way that they feel. So they might feel anxious, they might feel depressed, they might become irritable. Because obviously, if you start hearing things telling you somebody is going to do this to you, you are going to be wondering where that is coming from. You're going to be agitated, you're going to feel anxious. Oftentimes, people come to the attention of mental health as a result of that. So it will affect their sleep. It will obviously affect their interaction with other people. That is what we call, obviously, a very severe mental health problem.
All these cases? Is it medication?
Okay, I'm just going to take you back a little bit and talk about depression.
Oh yeah, that's good.
Because if there is anything that I want to focus on during this, is really depression, because those are really the common things that people experience. Depression is not, I'm just feeling down. Depression is a little bit more than that. So people experience lowering of their mood. So oftentimes we ask people, how do you feel? Some people will say, I feel sad. Some people will say, I feel unhappy. Some people will say, I'm just not myself. Among all the ethnic minority, some people talk about feeling of heaviness, sadness. Okay? And when people feel depressed, it begins to affect their sleep. They might struggle with initiating sleep. They might begin to wake up earlier than their normal waking up time, or the sleep is broken. Appetite is affected.
Okay.
People no longer feel hungry, and then of course they will lose weight.
Right.
People feel tired, heavy, and then people begin to lose interest in things.
Yeah.
They're no longer enjoying things that they would not normally enjoy. Concentration is affected. They're no longer able to pay attention to things anymore. And it goes on and on like that. And if that is going on for more than 2 weeks, you need to be seeing your general practitioner. Your GP will obviously see you. Your GP will ask questions. Your GP might complete a questionnaire for you. And depending on how many you score, the GP will be able to make a decision whether this is mild depression, whether this is moderate, or whether this is severe. And obviously, if it's mild, the GP oftentimes will just advise lifestyle changes. They will want to know.
That's good to know.
They will want to know why you're feeling depressed. Oftentimes, it's in the context of stress. Like I mentioned, with the recession, financial worries, people losing their job, relationship breakdown, relationship difficulties, anything that can cause stress will be one of the number one thing that can trigger a depressive episode.
I think it's good that our viewers are listening to this.
And I think it's very important. I really want to encourage our viewers, particularly people from ethnic minority. It is really nothing to be afraid of. Going to see your GP, telling your GP, you know what, I've got problem with my mood, I'm not sleeping. Most of us wouldn't say to the GP that we're depressed. We might talk about not sleeping. We might talk about not eating. We might talk about losing interest. Of course, a very good GP will immediately bring out that questionnaire and ask you a question. There is something that is really important that people need to be aware of. If you have depression and it's not treated, it is associated with risk. And that people begin to have thoughts that life is not worth living.
And that will lead to suicide.
People begin to lose hope.
Suicidal.
Yeah, people begin to lose hope. People begin to say, well, there is no point in me being here anymore. And then suicidal thought. Please, if you have that, you need to go and see your GP. And your GP will then refer you to the community mental health thing. It's nothing to be afraid of. Because if you were to go and see your GP, and your GP check your blood pressure, and your blood pressure is high, most of us, we will know, oh, the GP, there's something wrong. The problem with depression is that it's not the same thing as seeing your blood pressure up.
You can't see it.
You can't see it, but it's something that is affecting your mind. It's because at that particular time, the brain, what we call the neurotransmitters, the chemicals in the brain, something is gone wrong there. So the same way you need to take medication for high blood pressure to try and control it and bring it down, is the same way you need to take medication for depression.
But can I ask you a question? This is such powerful information, which I must say I'm tremendously blessed and encouraged to hear. If someone is suicidal or going through deep, heavy depression, does the medication really help? Because I've heard of a few cases whereby they're suicidal, they always kept the keys from them, did everything, but they still ended up getting away and committing suicide. And they were on medication. So is there instances where there's more that needs to be done, or the family needs to be encouraged? I'm not sure. How do we really know that these things can be treated? Is it possible they can be treated?
It can be treated, and I'm talking from experience. It can be treated, but it's not as straightforward as just giving somebody an antidepressant and telling them to go away.
Well, unfortunately, we're going to have to take a pause here. As I said earlier, it's going to have to be 2 parts. As you can see from the first part, there's so much information that Dr. Osoba shared with us. But in part 2, she will go even a bit more deeper into aspects of matters of the mind, depression, underlying factors that cause it, and how we can go through the symptoms, how we can identify the symptoms, and how they can be treated. There's so much more for us to listen to. So please join me in the next episode with Dr. Osoba. So until then, please be inspired, encouraged, and motivated.